Welcome to Health Away from Home, What to Expect When Seeking Health Services modules created by SDSU's Wellbeing and Health Promotion Office. This is Module 2, focused on health insurance basics. Part 2, Know Your Health Insurance. In this video, we will cover how to identify your insurance plan and coverage level, the steps and benefits of creating an insurance account, and finally, we will provide you with the different types of health insurance options that are available, as well as some common terms to help you feel more confident when navigating your particular plan. To understand which terms are related to your particular plan, we encourage you to locate your benefits information, which is usually found on your health insurer's website or in the brochure provided by your insurance company upon your enrollment. You can also review your benefits as we discuss some common terms and your explanation of benefits in further detail later in this video. Identifying your health insurance. The first step to understanding your health insurance is to identify your coverage. This can be done by accessing your ID card. Once you have your ID card, locate the phone number and member ID number. This information will be required to access your benefits, so it is important to have it accessible in a safe place. You can also take a photo of your insurance card or download a digital version in case you misplace or forget it at home. Next, if possible, you should create your online insurance account. You will begin by searching your insurance provider's website, which is usually located on your member card, and locate the register button and create an account. You may be asking, why do I need to create an account? Well, once your account is created, you will be able to learn about your plan's coverage and benefits, find and estimate costs for health services, see what is covered and get information about preventative care, view and pay claims, make monthly premium payments, view, download, and print member ID cards. Questions to ask your provider. All these points will keep you educated on your insurance policy and ensure that you are truly using your resources correctly. Because coverage will vary based on your plan, it is recommended that you call your insurance provider and ask the following questions prior to your first appointment. Will my health insurance cover me while I live away from home? At least a couple weeks before moving to the San Diego area, you will want to call your health insurance and make sure that you have coverage in San Diego. If your health insurance does not cover you for emergency services while living in San Diego, it is important to look for a plan that will cover you while you are away from home. Other questions you may want to ask are, what are my co-payments for an office visit or an emergency room visit? What is the closest ER or urgent care that will accept my insurance? What is my deductible and has it been met? If not, how much would I need to pay out of pocket? Is approval or pre-authorization required for referrals to a specialist? Types of health insurance plans. To begin, we will cover the different types of health insurance plans. Your plan type is usually located on your member identification card, or you can call your insurance and ask them to specify which plan you are currently under. A health maintenance organization, or HMO, is a type of health insurance plan that limits your coverage to a particular network of doctors, hospitals, and healthcare providers. In this plan, your insurance will not cover the cost if you go to a provider outside of that network. This type of plan usually offers a lower cost, but you will have a more restrictive provider network, and you're required to coordinate your medical care through a primary care physician, also known as a PCP. This is a great plan for someone who is interested in choosing their PCP to coordinate their healthcare while paying a higher deductible in order to lower their monthly premium. Another type of plan is a preferred provider organization, or PPO. This type of health plan contracts with medical providers to create a network of participating providers. You will pay less if you use providers belonging to the plan's network. Differences between HMO and PPO plans include network size, ability to see specialists, costs, and out-of-network coverage. With a PPO, you're still able to visit out-of-network providers for an additional cost. If you're interested in paying a higher monthly premium to get more choice in choosing your healthcare options and PCP, this may be a good plan for you. Similarly, there is an exclusive provider organization, or EPO, which is a managed healthcare plan where services are covered only if you use doctors, specialists, or hospitals in the plan's network, except in an emergency. This plan offers you a local network of providers for you to choose from. As mentioned previously, and out-of-network providers are typically not covered unless it is an emergency situation. If you're interested in a lower monthly premium while paying a higher deductible when you need care, an EOP may be the right choice for you. Finally, there's a point of service, or POS, which is a type of plan where you pay less if you use doctors, hospitals, and other care providers that belong to the plan's network. POS plans require you to get a referral from your primary care doctor in order to see a specialist. This managed care plan can be thought as a hybrid of HMO and PPO plans. Like an HMO, participants designate an in-network physician to be their primary care provider. But like a PPO, patients may go outside of their provider's network for healthcare services with a different level of coverage. When making a choice between your health insurance plans, remember that even though a plan may offer an overall low cost, you may pay a higher cost if you need to see a provider that is out of the plan's network or you need specialty care. It is important to reflect on your health and pick a plan that would work best for you and the coverage that you need. Common health insurance terms. Next, we will cover some common health insurance terms. Learning about health insurance for the first time can be pretty intimidating, as there are many different terms that we do not often use on a daily basis. Let's go over some of the most common ones that a person will come across when they're looking over their health insurance benefits and costs. The first and most common insurance term we use is a premium, or the amount that you pay for insurance, typically broken down into a monthly dollar amount. This is something important to consider when you're deciding which insurance plan you want to pursue, as it is the amount you will have to pay each month, regardless of whether you use your insurance plan that month or not. When we have an out-of-pocket limit, which is the maximum amount that you will have to pay out of pocket for covered services in a year plan. Essentially, you will not be expected to pay anything past this dollar amount in a physical year for covered services. Keep in mind that this only includes covered services by your insurance, often excluding out-of-network costs and services that are not listed on your plan's benefits. This brings us to the topic of cost sharing, or the portion of costs under your insurance plan that you will pay out of pocket. This includes copays, deductibles, and coinsurance. You're responsible for paying the cost-sharing amount from your own pocket. This is not common in most public health insurance plans, but if you would like to learn more about how cost sharing works, please visit healthinsurance.org/cost sharing. The terms presented on this slide all have to do with the cost-sharing aspect of your insurance, or what you will be expected to pay out of pocket. During your health insurance enrollment period, you will be expected to specify an amount for your deductible, or the amount you pay for covered services before your insurance plan begins to share some of the costs of medical treatment. Whatever the decided amount is, it will be in effect for the whole year until it is time to renew or enroll again. Let's pretend you have a health insurance plan with a $1,000 deductible. If you have an accident or develop an illness that needs a medical treatment, you will have to pay the first $1,000 in medical costs. If and when you have paid the specified amount on your deductible, your future payment will be determined by your coinsurance or the percentage of charges a member owes for covered services. Essentially, you are now splitting the cost of your insurance between you and your insurance. This split is illustrated as a percentage of what you will pay versus that of your insurance. Let's say your coinsurance responsibility is 30%. That means your health insurance provider will pay 70% of each future bill until you meet your out-of-pocket maximum for the year. When you check in at an office of your provider, you may be required to pay a copayment. This is a fixed amount you'll pay for a covered health care service after you have paid your deductible. A copay for a routine visit to your in-network provider can range anywhere from $10 to $50 and could be more based on your particular plan. You will have a different copay amount for different services that you seek, and these dollar amounts can usually be found on your insurance ID card. However, it is a charge that you will pay every time you use your health service, whether or not you have met your deductible. Medication coverage differs with each insurance plan. However, it is important to know the difference between generic and brand name prescriptions, as it can save you money. A generic drug is a medication created to be the same as an existing, approved, and brand name drug. This means that generic and brand name products are the exact same in terms of dosage, safety, strength, and routine of administration, quality, and performance characteristics. This is something important to remember the next time you are prescribed medication, as there may be an alternate option in the pharmacy that you can save money. The last slide covers terms that describe the relationship between your provider and your insurance. Your insurance will provide you with their network, which is a list of providers that your plan contracts with you, including your in-network covered and out-of-network sometimes not covered. It is important for your insurance to know your insurance network when choosing where to seek your services. Going out of network will often come with an additional cost, so make sure to confirm with the provider that they are in network before scheduling your appointment. Many medical offices are able to run your insurance plan through their system prior to scheduling an appointment and can tell what your expected costs would be should you choose to use their services. After seeking services from your health provider, your service will generate a bill that is known as a medical claim. This document is essentially the means of communication between your PCP and your insurance, and is sent to your insurance carrier to process for payment. Typically, it is sent by your insurance provider, but you may always request a copy of it for your own personal records. Now that we have covered common insurance terms, it is important to note that not all insurance plans have a deductible amount, cost sharing, or coinsurance. Be sure to contact your insurance carrier if you need clarification. When possible, it is generally recommended to choose your health plan provided by your employer, as they typically have the lowest out-of-pocket costs. There's also low-cost health insurance options that you can look into, such as Medi-Cal, Covered California, if you're currently a student, unemployed, or need additional coverage. If you have further questions about benefits, how to use them, or help with applying for health insurance, reach out to the Health and Literacy Outreach Coordinator via her email or phone number. You can find more information about the Wellbeing and Health Promotion Center here. Thank you.